On this episode of The Natural Plastic Surgeon, I meet with Ali Weiss and we dive into all things plastic surgery, Instagram, the Kardashians, and calling out celebrities.
All right, there we go. I'm so stoked. All right, Dr. Barrett. So I think a great place to start would be, as a plastic surgeon, what is the most common complaint that women have about their appearance? And I'm especially interested in hearing this from you because you live and work in Beverly Hills, which is the HQ of some of the most objectively beautiful women in the world. So when you get close to your patients and you're talking to them about what they're dissatisfied with, what they might want to work on, what do you see as their biggest insecurity?
So, I'm kind of biased. I'm a plastic surgeon. I do a lot of face and body procedures. But I will say that, the majority of women that come to see me have some kind of complaint about their bodies. And it's weird because, society has this standard. I think the majority of the complaints I see are body related. My breasts are too small. My breasts are asymmetrical. My breasts they don't look like normal breasts. So as a plastic surgeon, I do a lot of breast and body procedures. I would say I do that more so than I do facial procedures. When women come to I get a lot of women that come to my office, and I actually get a fair amount of men coming to my office as well. The number one thing that women complain about their bodies is typically breast related, or it could be after a pregnancy or after a weight loss kind of situation, right? So for a lot of women, they complain a lot about their breasts and how they appear. And the ones that come to my office, this comes from within. It actually doesn't come from like their boyfriend or their husbands. And if their husbands are involved, the husband's like, honey, do whatever you want. This is all you. And this comes from within, from women. And if, funny, it's a lot about having clothes fit right. It's like, I just don't fit right in my clothes. And the messed up part is that our society makes clothes as like a one size fits all, right? You got to have this certain figure with breasts are, a certain size compared to your waist, compared to your hips. And not every woman is built like that. And first thing I do is I kind of reassure my patients, look, you're completely normal. Breast asymmetry is completely normal. Or tuberous breast is actually a normal variant, right? And so, we start there and I'm like, they like, yeah, I know that, but I've been thinking about this for years, and I just want to do it, and it's a relatively straightforward procedure. So I'm like, great, then let's do it. And so that's one side of the things. The other one is more like the reconstructive side of things. Like, I've had 3 pregnancies, and the last one was twins, and my tummy was out to here, and it didn't go back right. And it's like, no matter, I'm a gym rat. I hit the gym, or I swim every day, and I just can't seem to get rid of that extra skin, or my muscles have widened. And these are women that just kind of want to get their body back, or they've had gastric bypass surgery, or they've lost a bunch of weight, and they work so hard, but no amount of diet and exercise could get rid of that extra skin that they have. And so that's where I love to come in, because I can kind of finish that whole journey for them and kind of put the icing on the cake, as I like to say it, to kind of get their body back. So those are kind of the two major complaints. Breasts that starts right at the end of puberty. Like, my breasts never came in. My sister has them, my mom has them, my grandma has them. I don't have them. And then I also get the women who, the moms and the people who've lost weight that complain about the stuff that they can't do anything on their own.
That's a really interesting angle that's never been mentioned to me before, is fashion and how important clothes are to most women, and not looking right in clothes could lead somebody to want to alter the way that they look. Because of course, when I think about beauty standards, and especially sexual beauty standards, I kind of always make the assumption that most women learn from porn, or they learn from the women that we see in Hollywood, or if you live in a major metropolitan area and you're surrounded by beautiful women, it's kind of that innate female to female comparison. But to hear it pertain to the way that we dress and the way that we show ourselves to the world, that's a really interesting way of looking at it. Have you ever had a patient who's come to you and said, my boobs don't match what I'm seeing in porn, or my boobs don't match the women that are inundating my Instagram feeds?
I haven't had women mention porn specifically, and I haven't had actually Instagram, I think, has come into play, but it's more self-reflective. They don't like how their body looks in either a selfie or photos. But when it comes to fashion, I can tell you about a patient that came in on Monday. She's a normal sized woman, but her breasts were way too big for her body. I mean, we're talking G size. And, you know, she was here to see me for a reduction because we do those as well. And it was all about fashion because she's like, there are about 7 different things that I have to consider when I go in to go for bikini shopping, or I go in to go dress for clothes and so forth. So, you know, that one experience, I'm like, is on the top of my head. But you know, I don't know. I haven't had a lot of women, you know, mention porn specifically, but I think Instagram and this, you know, this is the sneaky part about Instagram is what they see, and then they haven't really quite mentioned it, but they do pull up models to show me about in terms of when they want a Brazilian butt lift, which is a procedure I do where we do liposuction of the waist and then fat transfer to the buttocks. They do mention, you know, certain women and their bodies, and I know when I see them, I'm like, okay, this is a photoshopped result, right? And it's pretty easy to do now on Instagram or any social media or any photo really. And I'm like, that's not, you know, that's not always attainable. And I don't think everybody realizes that, and that kind of drives me nuts. And there's some celebrities that kind of go into that too. You know, celebrities that either get plastic surgery and don't admit it, so their bodies look, you know, really good, and then they make them even look even better, or you know, celebrities that are actually body, you know, or they're photoshopping themselves, which I think is also misleading to a lot of women who this is their primary source of, you know, the world now in terms of what women should look like.
Yeah, I'm really glad that you mentioned BBLs. Obviously, that is a procedure that's been tremendously popularized by the Kardashian Body. And I am a big believer that all women are entitled to look exactly the way that they want to look. And if you want to get plastic surgery, you should get it. But I've really taken issue for years with the way that the Kardashians have never owned up to the procedures that they've had, because you really study the dimensions of their body, not only with the procedures, but with all the photoshopping or the face tuning that's going on top of that. And you're like, what the fuck? Like, how in any way, shape, or form am I supposed to achieve that? And, you know, I wasn't even aware of a BBL before they kind of came into existence. But I would love to talk a little bit more about that, about if you've seen the Kardashian Body affect what women in your office are asking for. And also from your professional standpoint, regardless of whether or not you know for a fact, what you speculate all the Kardashians have done, if it's just a BBL, or you think that there are other things that have contributed to that now iconic figure.
Well, I love the Kardashians. You know, I think they're great. I do have the same issue that you have, but I think it goes down to publicity for them, because, you know, Kim Kardashian, when it first came out, it was about a sex tape, right? That was taboo and it wasn't supposed to happen, and try to keep it secret, or did they, or was it released on purpose? Do you know what I mean? And so it's like, you know, there's this whole publicity aspect to what they're doing that I think is kind of genius. I just wish that everybody kind of understood that, because going and getting your lips done with a bunch of filler, you know, 6-7 syringes, probably, perhaps, who knows, and then telling the whole world that they just look like that naturally is completely misleading. And,
or they're overlining
yes,
lips.
Right, exactly. That's what they said, and I was just like, you know, that's completely ridiculous. So you can see before and afters, and I actually have a series on my TikTok page where I actually I mention what work I think that each of the Kardashians might have had done, and then it's fascinating because then they set the trend in the other direction. So it's like, you know, Kylie mentioned she got all of her lips dissolved and she finally comes clean, you know what I mean? And then now everybody's not so into that kind of crazy overdone lip look, which I think is good, by the way. I think nice natural full lips is good, but overdone and unnatural can cause problems and so forth. So it's a yes and no with the Kardashians. You know, they're kind of a unique thing. I do think a lot of the work has been overdone, and they used it to their advantage and haven't been public about it. When they're in the public eye about it, and they've been asked about it by a lot of women who, you know, may have some insecurity body issues, and they haven't been honest about it. So I think there's some negative consequences there that I don't think they really fully appreciate.
Yeah, and similarly, I'm just thinking about other celebrities who have kind of morphed from one appearance into an entirely different one. You know, Bella Hadid is a beautiful woman, and she also seems like a really genuinely nice girl, but there are photos all over the internet of her the way that she used to look, and now having this entirely different angular, fox-eyed, cat-eyed face. And people have asked her about it point blank, and she said, no. You know, I remember there was this one quote. She said something along the lines of like, you can scan my face. There's nothing in there. There's no filler in there. But it was then revealed, not by her, but by people who were speculating, there was a procedure she had done, which I think had either pulled her eyebrows up or pulled the eyes out or something with threading, right? And that's this whole different angle of plastic surgery where you're not technically going under the knife. And so you're not lying, but it puts you into this gray area of something else that you've done that still creates this unrealistic expectation.
Yeah, yes, but you know, you gotta also look at these celebrities like Bella Hadid. When this happened, she was very young, you know, and I can't imagine like, you know, if my name pops up on the internet, I'm like, whoa, what happened? But like some of these women, and especially young women, are in the public eye to a certain level that it's like they can't even go out and have lunch without paparazzi taking pictures of them, right? So, you know, on one hand, I can see why they want to deny things because maybe they're insecure personally about some of these things that they've had done, but also the incredible pressure that they are in this industry, the double standard that exists for women, that they have to look good, they have to stay youthful, and all these things. So, yeah, but yes, I agree. That one was a pretty obvious cover up, and you know, I think she looks beautiful. I looked beautiful before, beautiful after, but I will say that, you know, I think it's totally okay for anybody that wants to do some things, but when you're in the public eye, I think there is a little bit of ownership that you need to, or at least a little bit of transparency you want to have for people, just for a lot of benefit for these young women out there and men.
Yeah, and you know, I bring these points up not for the sake of shitting on any celebrities. Again, I think everybody has a right to do exactly what they want to do, and God knows I've facetuned more than one photo that's gone on Instagram. We all want to look our best, but you know, it's just interesting to think about how there's this ongoing dialogue about how we need to start embracing our individuality. We need to start embracing different ideas of what beauty is, what beauty means, and I think all of that is so well and good and necessary. But when that dialogue is coming up against the Instagram age and the age of being able to have a wide range of procedures to subtly or dramatically alter the way that you look without having to go under the knife, I guess, how do we actually make change? I don't have an answer for this. I'm curious to know what you think, because we should move more in the direction of not feeling so pressured to look anything other than like our best self. But you know, regardless of whether or not we're famous, there's cameras on us all day. We're constantly looking at our own reflection and comparing that reflection to others.
Yeah, I mean, this is something I think about all the time. You know, I'm a biology major. I'm a man of science, right? I'm a plastic surgeon. We have to go through medical school, and I have a master's in physiology. You know, and you go back, you know, to how humans evolved. There's things like beauty, symmetry, round objects. You know, believe it or not, round objects stimulate dopamine in men's brains, right? You know, so it's like there's a lot to be said to wanting to look better, to have beauty. You know, beauty is power, right? And so there's a lot of competition in this world to get power, to elevate yourself. I think the question is kind of where do we draw that line? I struggle with it all the time. I have feminists that come into my office after, you know, years of trying to self-accept their bodies, and they're like, I cannot believe I'm in a plastic surgery office getting breast augmentation, and they're so hardcore about it, and they're like, this is just something that I can't get over, you know. So it's one of those things that is really fascinating. I don't have all the answers. I ultimately think I agree with you. I think it comes down to the individual. What you want to do with your body is your choice, and you know, if it makes you feel good, life is short. You know, do something about it.
Yeah, that's a fascinating point that you bring up. Oh my God, I completely forgot what I was going to say. Sorry. So this happens to me all the time. About, right, the feminists coming in. I remember what I was going to say now. The feminists coming in and them saying, you know, we've tried for years and years and years to radically self-accept, which leads me to my next point of, do you have patients who genuinely believe that altering the way that they look physically is going to help them deal with a deeper psychological issue, or with a more kind of existential unhappiness, dissatisfaction with life, or maybe it's even subconscious, like maybe they don't realize that they are dealing with a sort of trauma and they think that making a tweak here and there is a simple way to improve their quality of life. I would have to imagine that aside from being a plastic surgeon, you also kind of do double as a therapist sometime for people who come in and talk about the things that they're dissatisfied with. But that's a really interesting intersection that I would love to hear you elaborate on a bit more.
Yeah, I think as a plastic surgeon, 50% of my job is psychiatry, and it's you really have to understand people. You really have to get inside their head in terms of what they want. And when I first came out and I started practicing, I did a lot of more reconstructive, and then I started getting into the cosmetic side of things. And I'm like, okay, this is a superficial choice that people are making for their bodies. I'm going to do it. I'm going to do it well, and so forth. And whatever problems they have on their life is really unrelated to their physical appearance, because how the hell does that make sense, right? Mind over matter, right? And then I would say after my first year of doing a lot of cosmetic surgery, I changed my opinion, because these very successful women coming in who are insecure, or even some women who are just regular women that, just in school or whatever else, would come into my office, struggling over this situation for a year. I always ask people, how long have you been thinking about this? It's always years, right? And that's a long time to think about something, right? To finally make a change. Getting the operation, getting like a breast augmentation like a simple operation is a breast augmentation. There's a lot of complexity to it, but it's relatively simple compared to some of the other operations I do. Coming back in 6 weeks, completely holding like their shoulders back, their heads up high, like completely a different person and way more confident about themselves. Nothing else changed. Majority of people probably can't even tell that they had the breast augmentation, because we try to keep it natural and you can always kind of cover it up, and these aren't the type of women that are flaunting it. But something clicks in a lot of these women and men as well, that just changes their self-esteem. And I see one of the side effects of some of the surgeries I do is women, they often get engaged. Soon enough they're getting engaged, and they're and I don't think it has very much to do with the physical component. I think it has a lot to do with the mental component, because a very a person, a very strong woman or man who's self-confident is going to be successful in interpersonal relationships. And they're going to be successful with whatever they want to do. And so I find it hard now, because it's like, how is it that this is actually doing this for these people, these men and women? And but it is what it is. I see it with my own eyes, so, and I'm not trying to tout plastic surgery, but it's one of those deep things that people have. And there's a lot of women are like, hell, I'm not going to touch my breast, or I'm not going to touch my body. I feel great. And that's awesome. But then there's some women and there's some men that like, they really want to do something about their bodies, and it's bothered them for so long. And I think it might be subconscious. I don't fully understand the subconscious. It's 90% about like this chatter that's going on in our head. It definitely has a role, and where it starts, I don't know. But doing things like this, whether they make a difference on the outside or not, they make a difference on the inside.
Seeing as how my show is called Tales of Taboo, I am super happy that you brought up the taboo of beauty being power. I think talking about beauty now is kind of difficult subject matter to approach, because of the dialogue that I mentioned earlier of this almost pressure to embrace radical self-acceptance, and it's almost seen as being unfeminist, or it's seen as being not progressive or not woke if you admit to yourself and the world that you would like to fit into that kind of standard of ideal beauty. And to answer my own question that I posed to you earlier, I don't know that there's ever going to be a solution, because of course, the more women that embrace themselves and say, I'm perfect as I am, and find confidence from within to go out and accomplish everything that they want to accomplish, there will definitely be a domino effect, and that's fantastic. But there's so many years of wiring that both men and women have in terms of what they look for in not just like a sexy person, but a powerful person. And you can read a room and you can suck that energy right in. And so, you know, you have clients who come in and they get their breast augmentation and they come in 6 weeks later and they're like a changed person. The proof is in the pudding. So I don't know that there will ever kind of be that middle ground. I think it is just going to continue to boil down to personal choice. But I do think that it's wildly taboo to say people who look a certain way, regardless of whether or not they deserve that power, have that power. And by making slight alterations to the way that you look, you too can have that power. It's something that's sold to us incessantly through marketing and the media, but it's something that barely anybody actually verbalizes.
Yeah, I agree. I do. It is not talked about, and it starts from a young age. But I think it also goes back to like evolution, right? It's like, you know, how did we evolve? We like the people that procreated the most are here, right? So if you look over the million years of evolution, right? So it's like the things that we do now is at some point was beneficial to us figuring out how to procreate and have children. So it's like, you know, being in a powerful situation, you're more likely to gather resources for your children, and they're more likely to survive. Having more beauty, you know, if you go back to like you know ancient Egyptian artifacts, or even some artifacts in India, there's jewelry, there's makeup, there's all types of things. There's even body modification that people thought was at the time aesthetically, or we think was aesthetically pleasing, right? So this isn't a new concept. I do think that it is overdone now. You know, every single magazine, you know, makeup. You know, makeup is a form of altering your body, right? And people don't talk about it. It's like, okay, what's the difference in my mind from plastic surgery to someone putting on makeup every day, or someone going to the gym so they can look, you know, more fit? Yeah. I don't. Where do you draw the line? You know, so I think people that are critical about plastic surgery, I was like, is there anything you do to kind of make yourself look more presentable? And they're like, oh, I just do it for myself. You know, I'm like, okay. Well, that's what they do most of the time in plastic surgery.
I have to chime in here because I've had this conversation with people before, especially women in a generation that's older than mine. And their response is always, well, plastic surgery is permanent. You're permanently altering the way that you look. I go, but you wake up every single morning and you put makeup on every single morning. Right. So what is the difference between waking up and putting on the same layers and layers and layers, layer cake of makeup, and doing something that actually prevents you from having to make that change, or wearing a push-up bra every single day? I think you're completely right, Dr. Barrett. I don't really see that much of a difference.
Yeah. I mean, I think it's important to, you know, what I tell people, I think it's important to just kind of try to understand where these urges come from. You know, I tell them, I'm like, you know, it's like, do some self-reflection. You know, what do you see for your body? Is this really going to make you happy? You know, and try to figure out where this urge is coming from, and you know, is it coming from external? Is it coming from somebody else, or is it coming from within? You know, most people have actually already thought about this stuff, and you know, if it just makes sense, then go for it. You know, it's a shame that, you know, it's like, it's funny how like big breasts and like tiny little waists is so promoted in everything that we see. But at the end of the day, we got one life to live, unless you believe in reincarnation, and you know, live it to its fullest. If it makes you feel better that you get a little lipo to look better in your bikini on your spring break, then go for it.
Yeah. So how do you handle being in situations with patients where you firmly believe that they do not need the procedure that they're asking for, but they are so adamant that they want it anyway? Is there a two-way dialogue, or is it your obligation as the doctor to give them what they want? Because I would imagine that must take a little bit of a psychological toll on you as well.
Well, it's great what I do, because nobody needs the surgeries that I do. You know, it's like, it's not life-threatening. I mean, you got to describe what do you mean by need, you know? So it's like, you know, when someone comes in, they want to get a tummy tuck. They don't need it, right? They could perfectly be fine without a tummy tuck. I might make their abs a little bit stronger, their tummy flatter. But there are those people that come in that have body dysmorphia, pointing out like a bump in the nose that they see, that I don't see, and I can see almost everything. I can really see myself. I walk into a room, and 20 feet away, if there's a painting that's crooked, always since the beginning of my life, if there's a painting that's crooked, I could tell it's off. I'm like, all right, that's not okay, right? And I'm like, okay, well, I don't really see this. It's like, did you feel like, does it hurt or something? Or because like physically I don't see it, and then I'll take pictures and I'll show it to them, and they're like, yeah, it's like right there. And I'm like, okay. Those people I get a little more concerned about, and that is, those are major blind spots that they're having. A lot of times it goes along the line with body dysmorphia, and I think, you know, those are people that I don't operate on, because if it's not there to begin with, there's nothing I can do to make it better, right? If a woman comes in who has good sized breasts already and she wants a breast augmentation, I'm like, first of all, I always tell all my patients, I say, you're beautiful, and just how you are, your breasts are beautiful. And they're like, I know, thank you, but I want them to be fuller. And I'm like, okay, if you want them to be fuller, then let's do it. Show me a picture of like what you're thinking. And that's kind of how I approach it. I don't ever say that oh gosh, you need a breast augmentation to my patients. It's just because they don't need.
Yeah. So you do speak up, and you do say to them, in my professional and personal opinion, I don't know that this would benefit you. Because I've always wondered about that with plastic surgeons, and I've always wondered if you guys ever deal with having a guilty conscience.
Yeah. So my number one thing, whatever I do here in the office, I need to go home at the end of the day and be happy with myself for doing that. Did I make someone's life better in some way? Did I take the trust that they gave me and coming to see me as a plastic surgeon, that I can actually medically and surgically alter them in a way that is what they wanted and is what I promised to do? That's really important to me. It is not, I don't need, I'm not desperate for the money, right? So it's like, I want to make sure that people are going to be happy. So if they ask me to do something that I don't think is going to make them happier or is going to achieve what they want to do, I'm like, no, I'm sorry, I can't help you. And then, I can give them some referrals. And it's not always a good fit. You want to make sure that you're on the same page with your patients. And that's why I said plastic surgery is 50% psychiatry, 50% plastic surgery.
Yeah, so interesting. So we'll wrap up soon, but I would love to know how you feel about those kind of in-betweener procedures. So let's say that you're not ready to go for full-blown liposuction and you don't want to get like a full-blown tummy tuck. Things like sculpture or Coolsculpt, or, I don't even really know how that technology works, but you hear great stories and you hear horror stories. How do you feel about technology like that? And similarly, is there any technology breast-wise that is not a breast lift nor an augmentation that can help change the size or the shape of your breasts?
Yeah, there are some new technologies coming out, and some of them are very good. Some of them overpromise, underdeliver, unfortunately. I do think Coolsculpting works, and how they figured out about Coolsculpting is people riding horses in the cold, they noticed their lateral thighs that would constantly get cold from the air was actually thinning out, and like, okay, like a certain temperature actually will cause fat cells to die. So I do think things like Coolsculpting, I do think sculpture works, but it's pale in comparison with what you can do surgically. For tiny little stubborn areas, it's not a bad idea, and especially for people that don't want to have surgery. I think the important discussion is to make sure you talk to somebody that's going to be honest with you, that can actually offer you the full spectrum of things, right? That's not just a tiny clinic that can only do non-invasive things. Is this going to be a good thing for me? And they're going to say, of course it is, because they don't have anything else in their toolbox, right? So that's why, like here at our office, we have everything from like skincare all the way up to like major plastic surgery, so we can just kind of dial you in based on what you want to do. But I do think there are some good advantages of some of these non-invasive things for the right person. For breasts getting bigger, we have a lot of people that don't want to do implants, and that's fine. I also do a lot of fat transfer, so we can take fat from certain parts of your body. And so instead of doing the Brazilian butt lift, we can take the fat, put it in your breasts, and that's a home run, right? Take fat where you don't want it, put it in your breasts, and then you don't have the maintenance factor. The problem is we can't quite duplicate the size difference that we can get with implants. But if your goals are modest, it's like, why not? let's do it. And there's also other ways to make your breast bigger. You can get pregnant, you can breastfeed, you can gain weight, but those are not always convenient for most people.
Right, especially in Beverly Hills.
I know. So that's all I have at the moment.
That's really interesting, though. I would imagine that taking the fat from different parts of your body and putting it into your breast is a great option if you've just experienced like a little bit of deflation, like maybe you've had a kid, or just with age and time, if you just want like a little zhuzh without becoming a different person. In the back of my head now, I'm like, all right, after I have babies, that's probably something I would want to go for.
Yeah, it's a great newer technology that was developed in New York, and then we've copied it out here. So.
Awesome. So my last question for you is, we have seen a variety of body trends over the years. In the 90s to the mid 2000s, the uber skinny, jutting hip bones, kind of waifish look was very popular. And then as we discussed with the rise of the Kardashians, that kind of fuller figured, super curvy, heightened femininity look was really popular. I wonder if you think there's going to be another change, and if so, what that next change looks like.
It's kind of interesting, the past, it's only been very recently that I've gotten out of schooling. There was about 17 years of my life that I was locked away in a medical school or residency program, but I do remember some of these trends that were happening at the time. And I remember like a rap. Do you remember the rap song? It was Baby Got Back, like by Sir Mix-a-Lot. Yeah. And it was talking about butts, and it was like how, I was like, that's cool. I mean, butts are cool. That's great. Like we in the 80s and like from 90s and Baywatch, it was all about the breasts, and now it's about the butts. And then I think you're right. Now it came for about the breasts and the butts. So I think there is a slight trend going, even coming from celebrities, going towards more of a natural, balanced look, and more health focused. I think it's still the great butts, the great boobs, but in proportion. I think it is kind of dialing back a bit, and you can see a lot of celebrities kind of embracing that mentality, which I think is great.
I remember there was a slogan, it might still be around, but it was like strong, not skinny. I think there's been this emphasis on athleticism now and being able to really like perform. And you see a lot of female athletes that are on beauty and skincare campaigns and Evian campaigns. And I think that's really cool, and a pretty awesome halfway point to say, all right, we still value a body that's fit and tight and toned, but it's something that you too can do if you go outside and put in the work, rather than dumping thousands of dollars into getting an artificial procedure.
I do think a little bit of body fat is okay, right? So I think that we're also getting out of this famished, skinny model look that still kind of existed on the fringe in some of these modeling runway shows. And I think we're finally like, all right, hey, this isn't, first of all, this is like less than 1% of the population that can actually have a figure like this. And second of all, why is this so, I mean, they're very beautiful women, but it's like, why are we like focused on this?
Why do we want this?
This isn't like, the normal body fat percentage of a woman is like 14-15%. It's not less than 5%. That's so far off the scale, right? So I think in terms of, yes, fit, but not skinny, emaciated, starving looking. So like the models of like the 90s and early 2000s. So, which I think is good. So I agree with you.
Yeah. Cheers to that. Well, thank you so much, Dr. Barrett. You were such a good interviewee. I genuinely enjoyed this, and very, very enlightening, and some really great points that you made there that, again, you with the good lighting, other surgeons did not have the good lighting. You with the good points, other surgeons did not have the good points. Especially that bit talking about, beauty and its relation to power. I think that's really valuable. So thank you.
Welcome. Thank you, Ali. Anytime. I'm happy to chat with you.
Yeah. Love